This presentation will present the stages of postnatal development. Development is, by definition, the gradual modification of anatomical structures and physiological characteristics. This can be divided into two primary categories, prenatal and postnatal. Natal means birth, so prenatal development takes place before birth, and postnatal development takes place after birth. Prenatal development was discussed in a different presentation, so here we will only be discussing postnatal development. Postnatal development can be divided into 5 stages. Most of these are based purely on the age of the individual. The newborn, or neonatal stage, is from the moment of birth to 1 month, or 28 days. The infant stage is then from 1 month to 2 years, or the second birthday. The childhood stage is from 2 years to puberty. Puberty is the period of sexual maturation, but notice that it is not a separate stage of postnatal development. At puberty, the individual enters the stage of adolescence, and will remain an adolescent until the age of 18, or whenever growth is complete. This age will vary from person to person and from males to females. In the final stage, maturity, is considered from age 18 until the person's death. During the first 28 days of life, the new baby is called a newborn, or neonate. In the ideal setting, the baby is nourished by the mother, hence the presence of mammary glands. The first product of the mammary glands is called colostrum, and it is a yellowish, watery secretion, not what we think of as milk. This is just the right formulation for that particular newborn and contains antibodies that are delivered from the mom to the baby. Recall that this would be a form of naturally acquired passive immunity. After a few days, the breast milk comes in. It will have a higher fat content, but will also change composition as the baby grows and their nutritional needs change. There are still antibodies present, and an enzyme called lysozyme, which also has antibiotic properties. When the infant nurses, several things have to happen to stimulate the milk ejection reflex, sometimes called the milk letdown. This process happens every time the baby nurses. First, the contact of the baby's mouth on the nipple area stimulates the hypothalamus in the mom's brain. The hypothalamus makes the hormone oxytocin, and it is sent to the pituitary gland. The pituitary gland releases the oxytocin into the bloodstream and finds receptors in the mammary glands. This causes contraction of cells in the lactiferous ducts, causing milk to be ejected from the mammary gland. You might want to review the endocrine chapter for more information about these hormones, and the female reproductive presentation for the anatomy of the mammary glands. The muscles of the uterus also have receptors for oxytocin, so for about the first week or so, this release of oxytocin will also cause uterine contraction that help the uterus return to its pre-pregnancy size. If a mom becomes pregnant while still nursing, it is not recommended to pump towards the end of the pregnancy because that could cause premature contractions of the uterus, which might lead to a premature birth. There are a couple breastfeeding recommendations. The first is from the American Academy of Pediatrics, which recommends exclusive breastfeeding until 6 months, followed by breastfeeding plus complementary foods until at least 12 months, and to continue breastfeeding as long as mutually desired by mother and baby. The World Health Organization also recommends exclusive breastfeeding for the first 6 months, then to add complementary foods while breastfeeding continues for up to 2 years of age and beyond. As postnatal stages, we will skip infancy and childhood and go right to a discussion of puberty. Recall that puberty is the time of sexual maturation and marks the end of childhood and the beginning of adolescence. The age varies with the individual as well with gender. During this time, the sex hormones begin to circulate, primarily estrogen and testosterone. These hormones affect several different body systems. They are helped by growth hormone, thyroid hormone, prolactin, and some of the adrenocortical hormones. The hypothalamus first begins producing gonadotropin-releasing hormone, or GnRH, at puberty. This is sent to the pituitary glands, where cells are just beginning to become sensitive to GnRH. Gonadotropin-releasing hormone causes the formation and release of FSH and LH, and they begin to circulate in the bloodstream. At the gonads, which would be the ovaries and testes, cells are becoming sensitive to FSH and LH. This causes gamete production to begin and the secretions of sex hormones to begin, which is associated with a sudden acceleration in the growth rate. This will lead to a closure of the epiphyseal plate or growth plate in all of the long bones of the body. Testosterone is the primary sex hormone in the males. Many body systems are affected. In the integumentary system, there is development of terminal hair on the face, chest, and in the axillary and genital regions. As mentioned earlier, bone begins to deposit quickly, and this will lead to the closure of the growth plates. Growth of skeletal muscle fibers and a characteristic increase in muscle mass is seen as well. Testosterone will also activate centers in the central nervous system that deal with sexual drives and behaviors. Testosterone also stimulates erythropoiesis, which causes an increase in the red blood cell count or hematocrit seen in males. The characteristic deeper voice and larger Adam's apple in males is caused by how testosterone affects the respiratory system. The larynx grows larger, and there is a thickening and lengthening of the vocal cords. And there will be a stimulation of the reproductive system as well. Spermatogenesis is promoted, and the accessory glands of the male reproductive system are developed. In females, the primary sex hormone is estrogen. It targets many of the same organ systems as testosterone, but changes occur in what we think of as a characteristically female pattern. There is terminal hair growth, but only in the axillary and genital regions. Estrogen plus the hormones prolactin, growth hormone, and thyroid hormones initiate the development of the mammary glands. Estrogen causes a rapid closure of the epiphyseal plates much faster than testosterone. This is why girls generally stop growing first and are shorter, again in general, than males. Estrogen also stimulates the growth of skeletal muscle fibers, which increases the female's strength and endurance, but not to the same extent as the males. Again, in general, this causes females to have a lower body mass than their male counterparts. The central nervous centers for sexual drive and behaviors are also stimulated. While testosterone increases erythropoiesis, this does not happen in response to estrogen. However, estrogen does seem to decrease plasma cholesterol levels and slow the rate of plaque formation in the arteries. Therefore, premenopausal women have a lower risk for atherosclerosis than men. There is no characteristic response in the respiratory system to increasing estrogen levels. And at the reproductive system, the accessory structures begin to develop, and estrogen targets the uterus, causing the myometrium to become thicker and increasing the blood supply or blood flow to the endometrium. Many of these same body systems will continue to undergo changes as the person progresses through the stage of maturity. For more details about those changes, refer to each organ system chapter in your textbook.